Good day. My name is Michelle Lavander, and I'm the director of the USC Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Is Your Pandemic Coverage Powered by Public Records? Today, we're here to provide you with a host of practical tips and strategies for using public records to unearth the hidden aspects of how government runs. Before we get underway with a virtual room filled with so many journalists, I'd be remiss if I didn't mention that the Center for Health Journalism is currently conducting a last call for applications for our upcoming California Fellowship, which provides training, $2,000 reporting grants, and mentoring for journalists with a California-focused project they've always wanted to tackle, especially if they want some extra help. Our core focus for the program is health equity, and to learn more, email us at editor@centerforhealthjournalism.org. We'll also put more information on the program in the chat. Now back to public records. The pandemic has shown us the urgency as never before of finding out through public records how behind the scenes decisions are made, how equitably health resources are provided, or even such basics as getting local data on who is dying from COVID and who is becoming ill by age, race, and community. Some of the best accountability reporting on the pandemic has as its backbone data that could be acquired only through records requests. Here at the Center for Health Journalism, where we offer funding and 5-month training programs focused on investigative data reporting and tools, we've supported reporters who brought policy action by exposing lapses in how or when public agencies or nursing homes provided services to the frail elderly, isolated farm worker communities, communities of color, the homeless, and others, with basic services to keep them safe. And even though the pandemic numbers are trending downward, the need for accountability continues. Here to help you understand how to build your own reporting expertise on public records, we have two distinguished experts. Gunita Singh, a staff attorney for the Reporters Committee for Freedom of the Press. She works on litigation, policy, and amicus work, primarily around state and federal freedom of information requests. She also helps reporters and news organizations with records requests, and she'll talk more about that as well. And we'll hear from Derek Kravitz, the investigations and data editor for MuckRock, where he works on accountability journalism projects with newsroom partners. He's also working with Columbia and Stanford's Brown Institute for Media Innovation on the Documenting COVID-19 project, which hosts local, state, and federal document sets related to the COVID-19 pandemic and has produced more than 100 journalism projects. This webinar is made possible thanks to the generous support of the National Institute for Healthcare Management Foundation, the Commonwealth Fund, the California Endowment, and individual supporters like you. You could tweet about this webinar with the hashtag FOIA. We'll be archiving this conversation later today at centerforhealthjournalism.org. A word about our format today. We'll be hearing first from our speakers, and then we'll turn it over to our audience for questions. Feel free to share general comments in the chat. Because we have many people joining us on Zoom, we'll ask you to write questions for our speakers into the Q&A panel. You can write us there if you're experiencing technical problems as well. Now let's get underway. Gunita, why don't you get us started by sharing the landscape on public records, what's public, what's often called private but isn't, and more.
Sure, happy to do that, Michelle. Thank you so much for hosting this panel. I am going to go ahead and share my screen, which I just tested, so hopefully everything should look a-okay. Excellent, thanks for the thumbs up, Michelle. Just very briefly, as Michelle noted, I'm at the Reporters Committee for Freedom of the Press. And for those of you who aren't familiar with RCFP, we really try to be a one-stop shop for all of the legal needs that journalists and other members of the news media may have. So whether you are a blogger or a freelancer, or you work at an established newsroom, or maybe you're a documentary filmmaker, should you ever have any trouble navigating the public records process, I really hope that you will view the Reporters Committee as a resource. So yes, as Michelle noted, I'm going to dive into the landscape of what's available through public records laws with respect to your pandemic related reporting and where you may face some obstacles. So I will just start by noting the good thing about requesting records now at this current stage of the pandemic is that government offices have by and large forged a way to create some normalcy, right? Even as we continue to battle COVID-19, which stands in stark contrast to what requesting records looked like at earlier phases in the pandemic. I wanted to include this memo because this was issued right at the outset of the pandemic, where the White House instructed agencies that, quote, non-mission critical functions that can be performed remotely or that require in-person interactions may be postponed or significantly curtailed. And unsurprisingly, many federal agencies did, in fact, deem FOIA operations, quote, non-mission critical, resulting in tremendous delays in the processing of FOIA requests, both at the administrative phase, but also during FOIA litigation in federal court. And we also saw the exact same thing happen at the state level too, where governors were issuing executive orders to modify or suspend public records laws, where legislatures were voting to modify or suspend public records laws. And specific agencies and municipalities throughout the country were restricting access to public records. So I just wanted to include a couple of examples here to really paint a picture of how access was suffering for the majority of this pandemic. So here's some language from an executive order that the governor of Delaware issued, where he's basically saying responses to public records requests can be delayed until 2 weeks after the state of emergency ends, which left requesters in that state in a dire state of limbo for years. And we saw the same thing in Sonoma County, California. This was an actual response to a records request where the county is saying that it is not in the public's interest to divert staff resources away from pandemic relief in order to respond to public records requests. And I know that this is shocking to pretty much everyone here, because as we know, it's a deeply flawed premise to say that responding to public records requests is somehow detracting from the response to the pandemic. In fact, it can very much facilitate a robust pandemic response, as I know Derek is absolutely going to get into in the second part of this presentation. Just to round it out, here in Washington, D.C., where I personally live and work, the D.C. Council voted specifically to halt the processing of FOIA requests during, quote, days of a COVID-19 closure. So these are pretty representative of what we saw in dozens of states for the majority of this pandemic. Unfortunately, today, we're in a much different situation where these emergency measures have fortunately been repealed, rescinded, expired, et cetera, and those original statutory deadlines have snapped back into place. And of course that matters because there's still extremely critical time-sensitive reporting that needs to get done about this pandemic. And I want to provide you with one example of what I think is a critically important endeavor, reporting endeavor that was unduly hampered by these significant delays. So it's just a 1-minute clip from a webinar that I was able to participate in earlier, and we tested out the sound, so hopefully everything will be fine. Let me just get to... All right, let's go. Okay, here we go.
It's a kind of substantial level, and this, Gunita was mentioning this about the college in Florida, but in New Jersey, districts all had to create school closure plans, kind of contingency plans, what they were going to do with remote learning, special education, meal distribution, if schools had to close. Newark created one, and then after schools closed, a lot of districts started posting them online so the public would know what they were going to be doing during this time. Well, Newark did not, or at least it was nowhere that I could find on the district website. And so I have requested an OPRA, which is, again, as we were just talking about, it's the public records law here, a form to file a request with the district. And the custodian for the district told me that they would not be responding to any OPRA requests until the district and school buildings reopen. And that hasn't changed since then. And just yesterday, the state announced that buildings will be closed through the end of the academic year. We don't know when they'll reopen. So the district is treating that kind of as an indefinite suspension of having to respond to those policies. Then
So I find,
okay, within 7 days to respond. Now they
So I find stories like Patrick's so frustrating because government transparency isn't just some lofty or theoretical ideal, right? It is a principle that we depend on to really learn about the operations and activities of government and how those operations affect our daily lives, right? Reporting that Patrick was trying to engage in about how many students still don't have access to laptops during remote learning. What does meal distribution look like during a period of remote learning? Critically important questions that he was for so long denied access to. But fast forwarding to today, I'm going to turn next to discussing some additional obstacles that may appear as we're trying to get records related to the pandemic. And I'm going to start with HIPAA for the reason that during my interactions with reporters across the country over the last 2 years, no topic has been raised more frequently than HIPAA. No single topic has been raised more frequently than this. I kid you not. So state agencies and officials, as well as private entities like nursing homes, have been so quick to invoke HIPAA to bar disclosure of data related to both COVID-19 and their responses to it. And these denials of access have not only hampered public understanding and safety, but in many reasons have been legally unsound. So the scope of HIPAA's privacy rule is frequently misunderstood. And so I just want to provide a super brief high-level overview of what that looks like. And then I'll flag that if you head over to the Reporters Committee website, click Legal Resources, the first tab you'll see under that says Journalist's Guide to COVID-19. And we have compiled a wealth of resources to help you understand the scope of HIPAA because it is admittedly very complex. So if you still have questions after what I go over today, head over to our website. All of that is going to be there for you. So to start, HIPAA only applies to covered entities and their business associates. So we're usually talking about hospitals, clinical laboratories, and health insurance plans. And what is super important to remember is not all state health departments, public health, or communicable disease divisions are subject to HIPAA's mandates because those don't always qualify as covered entities. And of course, HIPAA's privacy rule does not apply to or bar the disclosure of aggregate or de-identified data. And finally, there are several exceptions to HIPAA's privacy rule, even if we are dealing with protected health information. So for example, if a state law or a local law is required to, if a state law or a local law mandates the disclosure of certain information, then HIPAA in no way, shape, or form can bar disclosure of that information. So you always want to make sure that you're checking state and local laws and regulations, in addition to examining whether and to what extent HIPAA applies to the information that you're seeking. Another exception to HIPAA's privacy rule allows covered entities to disclose even protected health information if it's necessary to prevent or lessen a serious and imminent threat to public health, and the disclosure is to a person or persons reasonably able to prevent or lessen that threat. So that's what we refer to as the public health exception. And I really think that government agencies need to bear this regulation in mind when responding to requests that potentially implicate HIPAA's privacy rule. And that's why I chose to include the headline that we see at the bottom of the screen, right? So consider Louisiana, where Black individuals in that state make up a significant percentage of those who have died from COVID-19. New Orleans Public Radio repeatedly sought data reflecting fatalities from COVID-19 broken down by race before that information was provided by the state. And my position is that if that data had been released earlier, then doctors and healthcare workers and critically communities of color could have had additional days or weeks to become aware of that trend and take corrective action. So if this is an exception to HIPAA that you want to learn more about and you want to find creative ways to invoke it if you are being faced with an invocation of HIPAA, I'm going to drop another link in the chat to a law review article that my colleague and I wrote, which explores this in depth in the hopes that you may be able to fashion a way to use it. Moving forward, how should you be approaching your reporting given the structure and scope of public records laws? So taking a moment to focus specifically on the federal FOIA, let's remember that federal FOIA applies to all federal executive branch agencies with very few exceptions. So with your federal requests, I'd encourage you to get creative and expand beyond just the traditional public health oriented agencies like NIH. Right? The pandemic is still affecting trade and foreign policy, for example. So I would be curious about how agencies like the Trade Representative or the Export-Import Bank and the State Department, et cetera, are examining issues of broken supply chains or even the import and export of APIs, right? Active pharmaceutical ingredients in conjunction with vaccines and other crucial pharmaceuticals. So let's think big, let's get creative. Before I head to the next slide, another thing I want us to keep in mind is as companies are continuing to be involved in COVID-19 relief efforts, agencies' use of federal FOIA exemption 4 is looking like it's quite common. So for those of you who may be novices to the FOIA landscape, exemption 4 is for trade secrets, business information, proprietary information, et cetera. And so if you're seeking, for example, submission data from companies producing, say, antivirals, exemption 4 is something that you want to be prepared to potentially face. So once again, you can find more information, a wealth of information, in fact, about how to challenge each of FOIA's 9 enumerated exemptions, should you ever face them, on the FOIA wiki. That's foia.wiki. So go ahead and bookmark it. It'll be your North Star throughout the FOIA process. It contains a wealth of information about not just exemption 4, but each of FOIA's exemptions. But very briefly, for the purposes of this presentation, with exemption 4, the main thing to remember is that the burden is on the government to prove that the information they're trying to withhold is a trade secret, it's commercial, it's financial, and it's also confidential. So you as a requester can always try to argue that the information is not commercially valuable on the basis that its disclosure wouldn't harm the company's competitive edge in some way. You can also try to argue as the requester that the information is not secret or confidential, right? Try to point to prior disclosures of that information in the past. I also want to encourage y'all not to sleep on alternatives to FOIA, right? The most valuable piece of advice I think I can ever give as a FOIA litigator is if there is a way for you to obviate the need to engage in the public records process, take advantage of it, right? Let's not sleep on grants.gov or state and local level databases and repositories for grant information where you can learn more about contracts, right? Public-private partnerships that have soared as entities are creating really robust testing infrastructures. Let's not sleep on proactively disclosed databases like the one I have included here from California, which includes turnaround data broken down by testing company, which is, I want to say, released on a weekly basis in California. So try to take advantage of those, right? And that's sort of the lasting golden nugget that I want to leave y'all with in my portion of the presentation, because the results reached from using public records can be so valuable and so gratifying, but the process is plagued by delays. It's plagued by oftentimes unjustified exemptions. And if I can spare any of you a headache, I feel like that's the greatest gift that I can give you. So I'm going to pause there And I'm going to turn it over to Derek to really dive into some more, reporting ideas, getting into the universe of record sets that exist. And by all means, don't hesitate to keep in touch with me and the Reporters Committee in the future. Take advantage of our legal defense hotline, where a public records attorney will be on the other end answering your phone call or answering your email. And that's my Twitter info. So if you have any other questions about FOIA or any other freedom of information goals that you're trying to achieve, I am absolutely here for you.
Thank you so much, Gunita. Derek, let's turn to you. You've been working with reporters all over the country on FOIA and PRA requests during the pandemic. What are some of your central takeaways and strategies?
And yeah, I'll just jump right in. But just as a quick reminder to everyone, we'll be here for a Q&A afterwards, and Gunita will be able to answer questions, legal questions, and I'll be around for journalism questions, and we can answer those as they come through the chat. So really quick, just a little bit about me and a little bit about MuckRock, which is where I work. I'm the investigations and data editor. MuckRock is a public records site, and so it essentially allows people to request through FOIA at the federal level or open records laws at the state level through its web system, and it actually facilitates the request from you writing it down and filling out a form and it turning into boilerplate and the request through the process to actually getting the records back. And it makes it either private or public, depending on your permissions. And it's a great tool for seeing what other people have requested from the same agency or what other people have gotten back. And it's just a great way to sort of see the universe of what is out there in terms of data and documents and public records you can get. Before MuckRock, I was at Columbia's Brown Institute for Media Innovation, working on grant-funded initiatives surrounding the Trump administration and COVID. I was also the director of research at ProPublica, the nonprofit newsroom here in New York. And before that, I was a reporter on Deadline, working on beats like public health and government and policy for the Wall Street Journal, AP, and the Washington Post. So I've done a lot of this work, on Deadline, and I know the difficulties people run into when they're requesting records and feeling like they're just insurmountable obstacles. So we'll walk through some short and quick hit type requests that have worked well during the pandemic, and we'll also talk about general strategies. I'm going to go through 5 very quick slides. I'm going to share this presentation afterwards, so you don't have to digest all of this, but these are 5 sort of very important things I remind everyone when they're filing a request. Having a good template, having actually a few good templates at the state, local, state, and federal level really will help you sort of not just conceptualize what you're asking for, but also force you to put down pen to paper in terms of the type of format you want the records back in. So do you want a PDF? Do you want a CSV? Do you want an Excel document? Do you prioritize segregating out information? Say you expect information to be redacted from your records. Is there a way you can segregate out those redactions and make sure you elicit a good response from the agency? These are a few template tools we use quite a bit, aside from MuckRock, Student Press Law Center, iFOIA, FOIA Machine. We also use the National Freedom of Information Coalition templates at the state level, which are great resources. Being very specific always helps. Narrower requests always get better results. There's a great study out of the EPA that showed that when EPA requesters put in ID numbers for facilities, their probability of a full grant jumped up more than 20 percentage points. So being very clear, being very specific, being reasonable in scope, including a date range, for example, providing links or attachments to records that have already been released that are similar or maybe the same exact thing that you're requesting, but just a refresh version, is just a great way of streamlining and quickening the process. This is in terms of getting records back in a timely fashion. So ensure that you're a simple versus a complex processing requester. Simple requests, 1 to 5 work days to process. Complex track processing, 21 to 60 days, but it can easily go way beyond that. So again, being narrow, being concise, being clear will go a long way. We teach everyone at Columbia and Stanford who are doing sort of large FOIA request projects to keep a tracking sheet as simple as a Google sheet. How long have you waited? What, do you have an acknowledgement letter? Do you have a tracking number? Do you have a point of contact at the agency? If you're doing anything more than, say, a handful of requests, this is a good way of making sure that agencies are being held accountable to statutory deadlines. Gunita will probably talk about this, but always ask for fee waivers. Your news media, you're entitled to that at the federal level and usually at the state level. You always try for expedited processing, usually by compelling need. Very rarely you can make the argument for imminent threat to life or safety. Compelling need is just a good argument for why your story is important in the public interest. Always talk to someone. I really prioritize actually making a phone call to a FOIA officer and treating them like a human or a source, or just someone who's not a disembodied email account. That building that rapport and actually having a real life conversation goes a long way. Also, these are people like us, and they are overworked and oftentimes underpaid and under-resourced. So that helps. And then again, we'll talk about this, but try the local route. So always don't necessarily go towards the federal system if you can get what you're looking for at the local or state level. Really quick, documenting COVID is just a massive repository of record sets from 44 different states, usually internal emails, memoranda, and health metrics. We work with journalism and a lot of data science graduate students and postgrads on these projects with partner newsrooms. A lot of the work we do tries to use public records to advance in a story. So we worked with a team out of the Detroit Free Press to understand why so many kids were getting infected in the Upper Peninsula of Michigan with COVID during the Delta surge. That allowed us to get contact tracing notes, which includes a lot of detail. They redacted the names, but everything else, the narrative was kept, so that was useful. Same thing with Cal Matters. We did a farm worker piece with actually one of the Center for Health Journalism California fellows. She was able to dig into why California's free COVID-19 hotel room pilot project largely failed. And we were able to get public records and inspection reports that showed that no one was taking advantage of the program and why. But we'll talk a little bit about why specifically requesting inspection reports or emails or memoranda goes a very long way during COVID. A lot of the great work we've done with meatpacking and migrant farms has been just simply disclosing where outbreaks are happening. And this was during the sort of the peak of the initial waves of the virus before vaccines were introduced. But we found a lot of cases where meat packers, private companies, and some publicly traded weren't disclosing large outbreaks amongst their workers, and also weren't necessarily disclosing deaths and larger systemic issues with their operations. Some really short-term or timely FOIA things to keep in mind. Requesting contracts. We got the Hart Island, New York request for proposals between New York City and Hart Island, which is the Potter's Field, where anyone that doesn't have the funds to pay for a burial is sent. That contract is a 3-year, $33 million contract, and no one had requested it. Contracts are very quick to return, so always just a good thing to ask for. Same thing about data that you wouldn't necessarily expect would be available. The Southern Nevada Health District, one of our researchers found, actually has breakthrough data by employment type. So how many casino workers or food handlers or students are infected with breakthrough infections in particular. That's really useful timely information, especially showing that casino workers are being impacted disproportionately in Las Vegas. Another good quick hit story idea: emails, memos, and texts. In Missouri, we asked for all memos from the health department director going in and out. And we found that there was a study that was commissioned by the governor, the Republican governor there, looking at the effectiveness of mask mandates. He had requested this study, even though he is very publicly against mask mandates. The study found that they are effective, and then he promptly buried that study. So we, of course, wrote on that. But the request language here is, all emails, including attachments contained therein, with a date range, and then containing any of the following non-case sensitive case or key strings: mask and/or mass, plural. Very straightforward, very limited date range here, but also very important when you're looking for like a very specific type of data or document. Really quick, data gaps. We typically find that even some of the country's largest states have huge gaps when it comes to race and ethnicity data, including for vaccinations, including California and Texas. This is all to say that knowing that these gaps exist allows reporters and journalists to know where to dig. So that might be looking at, say, a county data set that is collected with vaccination data that actually shows race or ethnicity that they collect, but then maybe don't share with the CDC. Data gaps remain despite de-identified records. So even though a lot of agencies redact, withhold PII or personally identifiable information, you can make sure to get good stories out of that just looking for demographic information, and that means race, ethnicity, age tiers, and zip codes. But again, looking at the states where they don't supply that information to the feds is a good sort of accountability journalism story. So Montana, Texas, Idaho, which doesn't collect anything. We've done a lot of work in the last few years looking at death records. A lot of counties and states collect way more data on deaths than they publicly release through death certificates. We found that a lot of death certificates have a lot of errors on them, 20 to 30% usually. And this dates back way before the pandemic. A lot of coroners and medical examiners are short-staffed, overworked, under-resourced, and are not properly trained in how to fill out a death certificate. So one very good, straightforward story is just knowing who's dying in your community. And a lot of counties and a lot of states actually will provide you a fully public list of everyone who's died, even including names and home addresses and other details, including, in some counties in California, occupation. It's messy data, but it's really, really impactful if you use it correctly. Just showing here the data that's available on the CDC is great, but it's really clunky. Building your own data can fill in the gaps. So that's a plug. And then last thing, I'll end on this point because I feel like a lot of people don't really fully appreciate the limitations of FOIA, and Gunita touched on that a little bit, but in a lot of cases, the data or documents you really, really want that can tell the story are just not available. They don't exist. And so we worked with a team out of Columbia and CUNY and a few other nonprofits in New York with the nonprofit The City to basically capture everyone who died from COVID in New York and allow the next of kin to help us write little mini obituaries for them. Nearly 40,000 New Yorkers have died of COVID in the last 2 years, but less than 10% of them have obituaries. And actually, surprisingly, obituaries are quite expensive. And as a result, it skews predominantly white and male and older. So we created this web portal where now there's several thousand obituaries available online, but we actually use some relational data in order to group them by employment type and nurses and doctors and healthcare workers. This project resulted in a ton of reaction and a lot of great sort of follow-ups and success from other places that basically copied it and used the CMS and framework, including in Minnesota and California. One thing that really helped this project was an engagement effort, a simple Google form that allowed us to ask people to supply their own stories and documents. And we found that when we did that crowdsourced push, our representative sample, our metrics in terms of the race and ethnicity of who was dying was more accurate than what we would get from publicly available sources, including New York City. And in the end, New York City ended up taking a lot of our data and using it for their own memorial projects. So we were sort of validated by that. But the other part of this is other stories come from this. You're able to, when you get great engagement projects, you're able to elicit stories from people about Hart Island, for example, or air pollution resulting in a disproportionate number of deaths near highways in New York. And so with that, we were able to really do some very complex data stories and some very straightforward accountability stories, including the number of inmates who died in city jails. So that's it for my presentation. Happy to take any questions. Here's all of my contact info for MuckRock. Derek at MuckRock, Columbia is my name, and then documenting COVID.
Thank you so much, Derek and Gunita. This is really helpful. We're going to turn now to all of your questions. We have a few questions in the chat, in the Q&A, and so that's where you should put them. That's where we're looking for them. I'll start out with some of the ones we have here. First one is from Meg Wingertner, who says, I'm pretty sure our local hospitals are lying when they say they couldn't possibly let our photographers into their overwhelmed ICUs because of HIPAA, given that other hospitals have done it. Is that correct? And is there anything to do other than call them on it and hope they're ashamed? And let me just add to this, Gunita, because I know that so often, this is a little bit outside the realm of documents, HIPAA is invoked as if the reporter is required to comply with HIPAA, as opposed to the organization, the hospital. And so maybe if you could clarify that too in answering Meg, that will be great.
Yeah, so I posted a couple of links, one of them in direct response to Meg's question. So I'll go ahead and put that in the chat as well. But I also posted a link to a reporters committee guide directly in the chat. So hopefully folks can see that. So this is where it's a little bit tough. So I'll say that first, there's a question of whether you're dealing with public property or private property, right? We hear from journalists who are trying to report from VA hospitals, which is government property. But even there, despite the First Amendment, which of course protects the news gathering rights of members of the news media, restrictions could look like what's called a time, place, and manner restriction on access. So if you are being faced with restrictions on news gathering on government property, feel free to get in touch with us through our hotline and we can help you analyze whether those restrictions are appropriate or not. If you're in a private hospital and the hospital is invoking HIPAA, it's a little bit tricky. So basically, if there is the potential to disclose protected health information through what you're capturing on your screen or what we're overhearing through audio, that could be a little bit tricky. But we have constantly heard success stories from journalists who are working with hospital staff to, basically hold their hand through the corridors, allowing them access during a really, pivotal moment in global history. And it is possible to achieve that balance, right? Derek spoke earlier about the importance of getting public information officers on the phone, getting them on the phone to say, hey, I'm not just a tracking number attached to a FOIA request. I'm a reporter who's trying to do really valuable reporting squarely in the public interest. Hospital staff, even if they're not, public information officers at a government agency, can still play that role in helping to enable that access if you tend to use honey rather than vinegar. So that's my 2 cents for now. Derek, if you have more to add, please feel free.
No, I think that, is a good sort of general takeaway, really connecting with someone and, if you need to take a more adversarial or sort of hostile witness approach, so be it. But again, starting with that initial phone call goes a long way.
So I'm going to read a rather long question from Aaron Miller. And Derek, maybe you could, as part of this, she says the question is mostly for Gunita, but she also mentions that she submitted a request through MuckRock. So maybe you could chime in afterward and explain how even that function of your work happens and what the options are for reporters. So I'll just read this. Aaron says that she's dealing with a situation with a request that she submitted on MuckRock to a federal agency asking for emails from a handful of specific individuals. And she said that the agency never sent an acknowledgement letter, so she doesn't have a tracking number for the request. But when she followed up, she was told by the agency that my request is still being processed. And she's been waiting for 6 months and doesn't know how to appeal without a tracking number, if she can appeal, since she doesn't know the status. And she wonders if there's any options for reporters or citizens when this sort of thing happens.
Yeah. Again, so the way I said earlier that HIPAA was the most common problem we've been hearing about with respect to pandemic related reporting in general, I can tell you that delays are the most general problem that we hear about from reporters navigating the FOIA process. The delays have become all the more exorbitant in light of COVID as agency processing was on hold for so long. So here are my general tips that I'm always giving to reporters. Don't be afraid to be a pest, right? Under the Federal Freedom of Information Act, which was amended in 2007 to specifically require agencies to provide you with an EDC, an estimated date of completion, you are well within your statutory rights granted by FOIA to ask for that EDC as frequently as you want. I have clients who are, pestering these agencies every 2 weeks. They have a reminder in their calendar, hey, what's the latest update on the processing of my request? And it's not guaranteed to get you a quicker turnaround, but it does remind the agency that you are there taking these statutory deadlines seriously, so they should try to do the same thing. Working with public information officers to narrow the scope of your request is an option. It's not always desirable, right? If you're confident that you framed your request appropriately and there's no way to make it more narrow or more discreet, then obviously don't sacrifice the scope of your request just to get a potentially quicker turnaround. But it's an idea, right? To narrow the scope of your request because there's almost always a trade-off between the scope and the timeliness of the response. With respect to your question of not even having a tracking number, that's bizarre. Get them on the phone, email them to try to get that tracking number, because you're absolutely right in terms of building up a robust administrative history, particularly if you eventually want to litigate this, and I'll talk about litigation in just a moment. Get that tracking number. It's happened to me a couple of times where the acknowledgement letter will just get lost in the ether. But I always have success getting a hold of that tracking number once I establish, correspondence with the PIO. And the last thing I'll say is litigation has frankly become your only guarantee to get a swift response, just with how egregious these agency backlogs have become. So if you're looking for pro bono litigation, here at the Reporters Committee, we're always, reviewing new matters for intake. So don't hesitate to get in touch.
Thank you. We have a question by Susan Batt who says, related to emails, how do you deal with and make sure to include when officials use their personal emails for state business? And how do you deal with this when you don't know the actual email address of every personal account the public official might use?
Yeah, and I was about to type an answer to this one, so I can quickly jump in here. But specifying that you want a personal email address included in the course of that public official's business and work product is important, and just bolding or emphasizing that in the underlying request will be helpful. Sometimes we've had to follow up and be very clear with a FOIA officer that we are not just looking for their work email, but also their personal email, and in some cases their cell phone and text messages. And in a lot of cases, text messages and WhatsApp messages and other forms of communication are equally valuable. So just being very clear on that in the initial request and follow-ups.
And Gunita, did you want to add anything there, or?
I'm
the
actually
emails,
posting, yeah, I'm posting.
Personal emails.
Yeah, I'm posting a link in the chat to the Reporters Committee Open Government Guide, because Derek is absolutely right. Within the body of your public records request, you should feel absolutely free to note that if you're looking for emails or correspondence or other records of communication generally, feel free to specify. Does that include records from platforms like WhatsApp or Instant Messenger? Does that include records where government business is being conducted on personal domains? And this is actually a really interesting body of law that's constantly evolving as new forms of technology become more ubiquitous. And so to the extent there are court cases that speak directly to this in your state, in the jurisdiction where you're submitting records requests, I would encourage you to peruse the Open Government Guide, because then you'd be able to cite to that case in your administrative appeal, right? If you're in a jurisdiction that permits administrative appeals. So feel free to check this resource. We're constantly updating it with new developments in the law.
Thank you. And Robert Cronkleton asked a question that Derek answered with a link in the chat, but I'll share it just because I think it might have broader interest. He says, with states transitioning to treat the coronavirus as an endemic, illness, I believe a lot of these states are removing some of the public data. He says Missouri is looking to do it by mid-March, and Iowa removed its COVID dashboards today. How will this affect access to data?
Yeah, Robert, that's a very timely question, probably one that is still evolving. We just wrote on that today in Missouri. Yeah, as states increasingly switch to endemic status, several states are in the process of transitioning or planning for that transition, including California, Colorado. They will be moving from daily reporting of COVID cases and deaths to aggregate weekly reports. Positivity rates, which are already difficult to interpret, are going to be reduced. Hospitalization data might be a little bit more difficult to come by. Increasingly, I'm seeing a lot of states start to focus more on wastewater surveillance, but yeah, in the same breath, only 10 states have really robust systems for that available. So there will be an effort, I believe, by some good government groups and nonprofits to capture the data that's already available. But there will be limitations going forward in the states that make that endemic transition and change their reporting standards. One thing I would caution is that if you are really mindful of what's being lost, counties and specifically metro health departments are probably going to fill the void to some degree, and especially with their more vulnerable, hard-hit populations, and continue some of the tracking and case investigations and case-specific reporting that might be lost at the state level. So I would definitely pursue that route, go local, as opposed to looking at for the state.
We have a question from Cindy Goodman, who says, any thoughts on how to get COVID death certificates from a state when medical examiners are no longer involved in the process?
I will respond to this as well, but yeah, when medical examiners don't have any sort of touch on the report, you can still get the data from the state or the CDC. And I would note that the CDC Wonder tool is great, and you can drill down now at the provisional sort of basis by county. So every county is reportable to the CDC. You can look at demographics, underlying cause of death, and a lot of other metrics, and then use that in order to compel release of more case-specific information from an individual county or state.
And Derek, I wanted to ask you if you could also elaborate on something that one of the other people with a question alluded to, which is filing a FOIA through your site. Could you explain that quickly?
Sure. And yeah, Gunita made a few good points on there. The only thing I would add on to that is with MuckRock, there's a dedicated support team of about 5 that who specifically, when you have an issue, say you don't get an acknowledgement letter or a tracking number, they will actually go and hunt that down for you and actually make the calls. That's not really like a well understood sort of, maybe as well publicized on the site as it should be, but that support team goes a long way. And so I would flag that and send that email through the MuckRock portal.
But when somebody said that they filed the request through MuckRock, how does that work?
It's typically a form that you fill out and it generates all of the template and boilerplate language and then sends that off through either a state or local or federal web portal or an email or other system. And it creates a unique email address for that individual request so that responses are then automatically fed into an OCR tool that embeds the response onto the page, allows us to see in near real time sort of where each request is. And so it's automated on that front end, and on the back end there's a lot of human work, labor intensive work in following up and pushing on those requests to actually be responded to. So that's the human element is the one that might help with the tracking number and acknowledgement.
And Derek, if somebody wants to keep their requests confidential from other journalists in a competitive situation, how does that play out?
You can embargo or you can make private. I would suggest, in the spirit of transparency, to embargo if you're going to go that route and embargo it to whenever your story or project comes out and then make it publicly available. But that's a good route to take.
And we have a question from Esmeralda Fabian, who says, is there any way to track student health issues caused by school closures due to COVID, considering that they are minors?
On this, I would note, don't sleep on school board meetings, right? At school board meetings, a hot topic right now is mental health ramifications of school closures, how to strike the balance between enabling robust learning alongside protecting public health, et cetera. So school board meetings are a great opportunity to attend and further your reporting either in person or over Zoom. Very briefly, I'll just note that FERPA, which is basically the equivalent of student records, the way I was talking about HIPAA earlier, the same general contours apply when we're talking about both HIPAA and FERPA. So FERPA also does not bar disclosure of de-identified and aggregate data. So that's also a tool that you want to keep in your back pocket if an agency is invoking FERPA to deny you access.
And Derek, did you want to add anything there? Or?
No, I think that covers. Yeah.
And we have a few more questions, which I'm going to do our best to go through. But before we as we're getting close to the end of our time, Derek, I did have a question for you, which is, as you're thinking about where we are at this stage of the pandemic, what tips might you have for the reporters gathered here about just like broad areas of inquiry that they should be thinking about, where public records could really be a backbone?
That one question about endemic transition plans, I mean, that's just on the forefront of everyone's mind at the moment, as data is changed and removed and altered. I think that's really important to keep an eye on. And thinking in terms of what documents or memos that local or state officials are not necessarily making public because of fears of messaging issues with the public or some other type of bad press. I think that's always going to be an area where the nexus between COVID and government policy faces a sort of a natural rub. So a lot of our work focuses on that. One thing I'll just quickly jump on, I see Helena Sellerman mentioned more of a FOIA question for New York City. Is it better to submit there on a portal or reaching out directly to an email account? Completely depends. The FOIA portal in New York City is actually quite good and responsive, but Parks and Recreation, Department of Mental Health and Hygiene, they're good, particularly by email as well. So it really depends. But I think it, again, like we both mentioned before, I think talking to a human person somewhere along the process, if that's before you file or right after, is good practice.
And Derek, are you folks and your team spending more of your time looking retrospectively at how things played out over the pandemic in its most severe stages, or are there areas of inquiry that you would recommend that are more, where we are now?
Looking at that slide we had from about meatpacking and migrant farms, it seems like a century ago, and I think a lot of people feel the same way. So we, I don't think we had the luxury at the moment of doing too exhaustive of a historical review of what's happened yet. I mean, hopefully with the commission, the federal commission coming on board over the next year and producing their 9/11 style report, that'll answer some of those questions. But I think we're still sort of at that point where we're trying to keep up with the news, unfortunately.
So I'm just going to go through some of these last questions. When you're doing a FOIA request at the state level, is it common for public officials to hold back information to protect their community?
So the important thing to keep in mind is the burden is always on the agency to justify its withholding or redactions of information by citing to a specific provision in the state statute. And I say state statute because it looks like the question was tethered to a state public records request. So if for some reason the agency is giving some vague or amorphous, justification for its withholding, you always want to push back, ask for more information, ask them to cite to the relevant statutory provision, because a lot of times those exemptions are discretionary, so you will have some wiggle room to challenge. It sounds pretty vague, based on the question, some protection to the community. It's possible the statutory exemption may be something along the lines of a law enforcement exemption, where disclosure of the requested information might lead to circumvention of the law in some way. Maybe that's the community protection angle they're looking at, but otherwise, yeah, definitely ask for more information about the statutory basis for withholding.
And we have a question from Neil Elkin, who says, has the VA at a federal or regional level been responsive to FOIA requests regarding COVID?
Yeah, so we've been tracking federal and state agency responses and closures during the pandemic. And, on the pretty egregious side of things, we've seen the State Department and the FBI, close down operations at various points in the pandemic. The VA, we've seen fewer of those disruptions. My experience has been, fairly positive with them, actually. They're continuing to make productions, continuing to be, as responsive as they ordinarily are outside the context of the pandemic. But maybe, Derek, you have different experiences.
No, I think that's right. The VA historically has had actually a quite decent response rate, comparatively to DOJ or DOD or DHS. So it's a good place to start. And one quick question that we answered in the chat: is there a way that comes to mind to track COVID infections in religious communities? I just noted here, as long as you can use a proxy for religion in community, say a zip code or a demographic, the short answer is yes. But it does pay to be creative when thinking about how to isolate out say an infection rate or death rate or hospitalization rate for a community that maybe isn't necessarily tracked or noted in intake forms. So say it's a small community that has a very high population of a particular religion, pinpointing where that community is located and looking for some of the metrics there is a good start.
So I think we're coming to a close. I want to thank our two amazing speakers for all of these resources and ideas. Somebody asked if the information from the chat will be captured. We'll add that to the resource list of our centerforhealthjournalism.org webinar page for this webinar, along with the recording of this webinar. And we would ask you if you could just take a moment. We'll be sending you all a survey shortly about this program. Also, should you want to support our webinar series, here's some information on how to do that. And you know, you'll also find some information on our webinar page about our next webinar with a preeminent health equity scholar who did one of the definitive reports on health equity in health settings nearly 20 years ago, and where we are today. That will be next week. And with that, I want to thank our panelists. I want to thank our audience for their fabulous questions and wish you all a good day.